And so with this client, her concern is acne scarring. So we're gonna go at a lower depth all over, and then in the area where she's got the scarring, I'm gonna go deeper. I'm gonna do a couple of cross-hatch passes and then stamp. So first I'm cleansing her skin. And this is something that I do with the bare hands. I think it's nice to have physical touch with the client. And then the rest of the process will be with the gloves on. So this is just the initial cleanse, just to remove any makeup or any SPF that the client has on. And so your before pictures would come after cleansing the skin. And so with this client, like, her concern is some of the acne scarring on her cheeks. And she doesn't really have a big area, it's just in here. So we're gonna go at a lower depth all over, since her skin is not problematic. And then in the area where she's got the scarring, I'm gonna go deeper. I'm gonna do a couple of cross-hatch passes and then stamp. Okay, so now that we've got our skin nice and clean, I'm going to numb her. Okay, so with the numbing packets, you're gonna mix all three, the benzocaine, the lidocaine, and the tetracaine. And the nice thing about these packets is it's already measured for an area, so you're not using too much. So after you've taken all three out, you're gonna mix the three. And then I just like to apply it to the skin first and then rub it in afterwards. That way you're not missing any area. It's really important when you're doing the forehead that you take it all the way to the hairline, because it's the most sensitive part of the face. Now with this client, she's got nice full brows, but for some people that have had microblading, you want to avoid where they've had that because you don't want to break down their brow work. Or she's just got the nice natural brows, so she doesn't have to worry about that. And just massage it into the skin, making sure we've covered everywhere. And we're gonna leave this on 20 to 30 minutes. Once she feels nice and numb, then we'll get started. So with her, I'm gonna do the restore needle. I think when you're working on scarring, it's gonna be more effective because it's gonna go deeper in the skin. Whereas the refine would be a good fit for someone that just wants to work on the collagen buildup, someone that's got maybe more sensitive skin, someone that doesn't want to have to worry about the numbing or the downtime, because with the refine needle, you won't get redness like you will with the restore. So now I'm just gonna remove the numbing cream. So before using the cleanser, I just like to wipe with the 4x4s. This way the numbing cream doesn't cake up too much and you're not just moving it around with the cleanser, you're actually getting it off. So first I do the 4x4 and then cleanse. And this is something that you wanna apply a little bit of pressure for, because what you don't want to do is to drive the numbing cream into the skin with the microneedle. Okay, so now we've got the majority of the numbing cream off. Now we're going to go into the cleanse. I'm just going to use our cleanser. And this is a great cleanser for prepping the skin because it's a foam cleanser. So it's going to clean out those pores before we go into the treatment. Now we're going to remove the cleanser. So then you're going to want to prep the skin. So you prep the skin with either rubbing alcohol or with witch hazel. So with her skin type, I think witch hazel would be nice. The chemical peels are nice. They've got some benefits. Within her case, since she's got the acne scarring, the chemical peels be a little bit more surface. You want to get down into the pores and let the skin heal itself by building collagen. So over a series of treatment, you'd be smoothing out her skin. Chemical peels, if you wanted to, you could do, if you wanted to alternate, so you could do like the microneedling and then have the client come in for a chemical peel a couple weeks after. All right, so the first step I'm going to do is I'm just going to use a little bit of the copper mist. I'm just going to spray her skin with the copper mist. This helps with inflammation, also healing. We're going to use the HA now that we've sprayed the skin with the copper mist. And we're going to use approximately 7 pumps of this on the face. So we're not touching the container over. I just like to use a side container. So with her, I'm going to use the Restore needle. I'm just going to put it on and twist it to lock it. And we're going to calibrate the pen. So you're going to turn it on. You're going to make sure it's at 0. Speed on high. Then turn it down to the settings that you want for the client. I'm just doing the cross hatching. So this is my second pass. My first pass was going upward. This is diagonal. And we're going to go down with the forehead. You see her skin's getting a really good response. And we're going to do her other side. You don't want to draw too much blood, just pinpoint. She's got pretty sensitive skin, so I go light on her like we're doing thin skin, and then I go thicker, or actually I stamp where she has the scarring. Do your head to the side a little bit. So we're just doing our first pass, which is upward. And then we're going to go diagonal. You hold the skin kind of taut, not too tight, but you don't want too much movement. And then you're going to go downward. And just 1 inch per second. So that's our forehead complete. You can do up to 3 passes, 3 sets of cross hatching, but with her skin, definitely 1 is enough. You can see that. Now we're going to go into her cheek area. Does this feel fine?
It's a little painful.
Is it tolerable, or you want me to go just a little? So with the microneedling, it's important to set your depths according to the skin type and the skin area. So her skin type would be thin, So we're gonna go in a lighter setting, lighter depth, but then where she's got a little bit of scarring, then we'll go and stamp it at a deeper depth. And right now we're just driving the hyaluronic into the skin, which is great for the skin. All right, so now we're gonna come back over here and just where there's a bit of the scarring, I'm gonna stamp. And just kind of hold the stamp down for a couple of seconds. And then we're gonna go to the other side of her face. This side you can see it a little bit more in here. Hold it firm and just stamp. You can go up to 2.5 with this. It's totally not necessary with her skin. But someone that's got deeper scarring, you could do up to 2.5. And I like to work from the top of the face down. So right here, you can see a little bit of the pinpoint bleeding. And over here too, you're seeing the pinpoint bleeding. So with the nose, you're gonna hold it to the side, holding the nostrils shut. And same with the other side. And just stamp across the nose. And this will help with minimizing her pores. And with the mouth area, you're gonna come up and then across, outward. So it's with the lymphatic system. Same over here, you're gonna go in and then out. Put the hyaluronic, see how the skin's drinking the hyaluronic? So you really just wanna put it on the side that you're working on and then reapply as you go. Out and across. And over here, the same thing. And lastly, I'm just going to do around her eyes here. The eyes, it's important to hold the skin firm and then just move outward. You never want to work inward with the eyes. And with this side, you're going to hold the skin firm. I'm just going to scoop under and just scoop. So any leftover hyaluronic, put it on the skin. This is a great time to, if their client wants to do the gel mask, this is a great time to boost the effects. This is the moisture recovery gel. Just one pump is plenty enough. I'm just going to put it nice and thick on her skin. This feels really good if you've got any redness or sensitivity. It's really soothing. And then because of the human growth factor, you're going to get the cell turnover a lot quicker and let the new skin come in. And then the healing process help with the scarring area. So this mask you could leave on for 15 minutes. I'd prefer for her just to keep it on. And then the last part of the service is you're going to use the copper mist. We're just going to mist her skin.